All right, so let's look briefly at the classification of leprosy. We've spoken about leprosy disease for a while now. We said that leprosy is caused by the mycobacterium leprae, and basically we have like two main classifications of leprosy. Okay, we have the LL, that's the lepromatous leprosy, and we have the TL, that's the tuberculoid leprosy. All right, so all of them will be talking about them just briefly because we have lectures coming on each of these concepts. Okay, so we said that two pathologic extremes are recognized based on host resistance. Do you understand? So now for the host to actually have lepromatous leprosy or tuberculoid leprosy, it just depends on your immune system. If your immune system resists the mycobacterium leprae very well, you have tuberculoid leprosy, which is mild. If it doesn't, okay, if it doesn't, then you have this lepromatous leprosy, which results in all these adverse reactions. What you're seeing on the screen is lepromatous leprosy, okay? And these features is what leonine fasces. Beneath the leonine fasces is what we call the foam cells or the Virchow cells, okay? Now let's start with this adverse one, which is the lepromatous leprosy. In lepromatous leprosy, I told you guys that your immune system depends on your immune system resistance. So this one is adverse. It eats up your immune system, right? You see the macrophages that are supposed to fight the disease conditions. They are being filled up with bacterial toxins and lipids. It will kill all your macrophages, okay? So lepromatous leprosy is there's a severe impairment of the cell-mediated immunity. There's unrestrained multiplication of the mycobacterium leprae. I've already explained this, and this is because the mycobacterium leprae is to go near a macrophage so that the macrophage will kill it. If the macrophage try killing it, to fill the macrophage with bacterial toxins and lipids and all the stuff and kill the macrophage, okay? So that it will just be multiplying without anything restricting it. So lepromatous leprosy is multibacillary. When they say multibacillary, that means that the number of deformities you'll be having on the skin or skin patches will be more than 5. You can't even count them. Do you understand? It's a multibacillary condition. And it's characterized by what? Polymorphic lesions. The skin and the nervous system are both severely affected by multiple lesions, which are what? Symmetrically distributed. Now, nerve damage occurs late, but the patient may suffer from total loss of what? Sensitivity. All right. Now, moving on, let's talk about what? And this should be a tuberculoid leprosy. Just some few lesions, okay? Mm, there are no adverse causes, like adverse signs like that. You understand? So the tuberculoid type of leprosy, we said that the cell-mediated immunity is intact. So you'll be having scanty multiplication of the organism. Your immune system is kind of like trying to still resist it. Do you understand? So now in between the two extremities, we have the borderline cases. That's the borderline type of leprosy, which is transitional. Now, this borderline type of leprosy, here you have the leprosy but at the mild state. So now for the leprosy to develop into tubercular leprosy or lepromatous leprosy, it depends on the strength of your immune system, okay? So now we have borderline cases which are not stable clinically and change to one of the extreme forms, often following a reactional state, okay? So now basically like if they get past some immune system, then they become either, if they get past your immune system so much, they become the lepromatous leprosy. But if they get past just few immune systems, immune cells, they become the tubercular leprosy. So the tubercular leprosy is associated with the most striking immune response and manifestations, okay? As you'll be having very dry, scaly, hypopigmented patches or plaques with very sharp defined edges, okay? Yeah. This is a very good image for the tubercular leprosy. Very sharp defined edges you'll be having there, okay? So we say that the plaques are usually anesthetic, except those on the face. Do you know what is anesthetic? Anesthesia. You know it's anesthesia. You will not be feeling sensation again. You'll not be feeling temperature. You'll not be feeling pain. Do you understand? So this will tell you that Leprosies come with what? Nerve damage. Okay, so now the number of lesions ranges between 1 to 5. So now if lepromatous leprosy was multibacillary, this one just having, that means it has more than 5 patches or lesions. This one having 1 to 5 lesions is what? The palsy bacillary. That's how they call it. Okay, just 1 to 5. Okay, that's it about what the classification of leprosy, being classified into the lepromatous leprosy and the tuberculoid leprosy. Borderline leprosy is just in between and not really recognized. Alright, so that's it, guys, and bye for now.